So good day everyone, I am Mary Jane Ardabuan from BSN Section B. And for today's video, I will tackle about the life cycle and the other important matter about my parasite, which is the Schistosoma mansoni. So what is Schistosoma mansoni?
Schistosomiasis is a tropical disease caused by a group of parasitic worms called schistosomes. These worms are also called blood flukes. The disease has affected people for thousands of years, and evidence of the disease has even been found in Egyptian mummies. Schistosomiasis is also known as bilharzia, named after Theodore Bilharz, who first described the parasite in humans. It's estimated that over 200 million people around the world are infected with these parasites. In sub-Saharan Africa alone, it causes over 200,000 deaths each year. Schistosomes have a very complex and interesting life cycle involving humans, snails, and fresh water, such as lakes, ponds, and reservoirs. 5 main types of schistosomes are responsible for most human disease. They differ in their distribution, the kind of disease they cause, and the type of snails that they live in. Hematobium is mostly found in parts of Africa and the Middle East, and causes disease in the urinary and genital areas. Mansoni are mostly found in Africa, South America, and the Caribbean. Japonicum in parts of China and Southeast Asia, Mekong-E in Cambodia and Laos, and Guineensis in Central Africa. These affect mainly the bowel and liver. Let's have a look at their life cycle. Infected humans pass schistosome eggs through their feces or urine into fresh water. These eggs then hatch into larvae and infect certain species of snails. After a period of development in the snail, they're released back into the water in a form called cercari. The cercari swim and penetrate the skin of a human and can enter the body of someone using the water. Once in the body, they find their way through the lungs and into the liver, where they grow into adult worms. They then migrate into blood vessels surrounding specific organs, where they can live for many years. Some species of Schistosoma like to live around the bowel, whereas other species prefer living around the bladder. These adults can lay thousands of eggs a day. Some of the eggs find their way back into the water through urine or feces and start the life cycle again, but some eggs get trapped in the organs. Schistosomiasis can cause both short-term and long-term disease. When the cercari penetrate the skin, some people develop an itchy rash called swimmer's itch or fisherman's itch. Some people can develop a syndrome called acute schistosomiasis, also called Katayama fever. This occurs about 4 weeks after being exposed to the parasites for the first time. It usually presents with a fever and a range of other symptoms, such as diarrhea, rash, and respiratory symptoms. This is usually self-limiting. The long-term effects of schistosomiasis are more serious and occur as a result of the eggs that are trapped in various organs. The trapped eggs can lead to changes in tissues characterized by the formation of granulomas with a lot of inflammation around them. In the bladder, this can lead to hardening of the bladder wall, obstruction, and can even result in a type of bladder cancer. This can present with symptoms such as blood in the urine. Intestinal schistosomiasis can lead to symptoms such as abdominal pain, diarrhea, and blood in the stool. In the liver, the eggs can cause scarring of the tissues around the vessels of the liver, obstructing them, and can cause enlargements of the liver and spleen. Other organs that can be affected include the genital system, lungs, and sometimes even the brain. Chronic infection, especially in children, can lead to anemia.
These are the diagnostic tests of Schistosoma mansoni. First is stool examination. Second is polymerase chain reaction or PCR. And the last one is the imaging studies like ultrasound and CT scan. So for the treatment, we have the praziquantel, effective against all major species of Schistosoma mansoni. The dosage is typically 40 to 60 mg, and the route is oral with water and preferably after a meal. So for the prevention, we have health education and awareness. Educate communities, especially in endemic areas, about transmission, symptoms, and also the prevention of Schistosoma mansoni. Next is safe water and sanitation. Improve access to safe and clean water sources to reduce the risk of exposure to contaminated water bodies. And that's all. Thank you for listening. Bye-bye.